Fractional CO2 for under eyes versus surgery. What do you recommend? I had upper and lower eyelid surgery about 10 years ago. I had bags under my eyes, but my doctor thought my skin was tight enough, so didn't recommend cutting the skin to tighten it under my eyes. 10 years later, my under eye area has a lot of extra skin when I smile. I recently went to a plastic surgeon who told me surgery was not an option because it would pull my eyelids down too much on bottom. He recommended I do CO2. I worry CO2 will hyperpigment and not give enough results. Thoughts?
Thank you for your question. You've submitted a photo, and in the question you're basically trying to figure out what's better, a fractional CO2 laser or a surgery for the under eye lines that are apparent in the photo you submitted. You described in your history that you had upper and lower eyelid surgery 10 years prior, and then at the time it was determined that your lower eyelid skin was tight enough that you did not need any skin excision, that you recently went for consultation to a doctor who also recommended not having surgery at the risk of potentially causing the lower eyelid to pull downward. In addition, you also mentioned that the doctor recommended CO2 laser, and you're concerned about the potential of pigmentary changes as well as the possibility of getting a satisfactory result. Well, to give you a little bit about my background, I'm a board-certified cosmetic surgeon for full-body cosmetic surgery. In addition, I'm a fellowship-trained oculofacial plastic reconstructive surgeon. This means that my specialty training after eye surgery, which was my first residency, was in specifically advanced training in surgery of the eyelids, the orbit, the bones around the eye, the lacrimal tear duct system, and facial cosmetic surgery. So aesthetics around the eyes has been something that's been a core of my practice for over 20 years in Manhattan and Long Island. So just to give you some sense of whether you're in the right direction, I'd say that you are definitely being guided very well. The complication your doctor referred to is something we deal with a lot. I have achieved a certain reputation for repairing complications of cosmetic eyelid surgery, and one of the most common problems we see in our practice who come to us from all over the world is lower eyelid retraction. And this is often due to cosmetic eyelid surgery as well as from different types of thermal devices, specifically laser devices. What happens is the eyelid actually retracts downward, or sometimes it actually everts out and retracts downward. And basically my job is to restore the integrity and the support systems that have been compromised from this surgery. Now, the evolution of the way to approach under eye lines has been a progression over the past 20 years. In the beginning, we were using a full ablative, very aggressive CO2 laser, which could create very good results, but unfortunately, a lot of people also had complications, which then kind of veered people away from the full ablative CO2 laser, and we were using the erbium laser for many years. This same erbium laser has now been retooled in different ways for various fractionated devices. But that was a laser that had less thermal energy, and part of treating wrinkles does require a certain amount of heat, but it has to be just the right amount. So in the past few years we've been using fractional CO2 laser. Now it's very important to understand that the words fractional CO2 laser is not a solution in and of itself. It's how the doctor uses the fractional CO2 laser that makes a certain difference. Experience and method and technique are critically important. It's not a generic procedure. At the same time, I would also say that what we've done in our practice to address those two concerns, pigmentary issues, and for lighter skinned people, basically it's not usually hyperpigmentation, but it's usually hypopigmentation or loss of pigment that's of concern, as well as getting optimal results. It's important to understand that you should define success by improvement, not by achieving porcelain smooth skin. Trying to get porcelain smooth skin under the eyes is very difficult and impractical. The skin is only 0.5 millimeter in thickness. It can only be heated up so much. Now we actually developed a combination approach in our practice. We use something called platelet-rich plasma. Now platelet-rich plasma is derived from your own blood, and it's the healing growth factors that are needed for wound healing that we have found works very well in synergy with thermal energy, whether it's CO2 laser, fractional CO2 laser, or with Peleve. And it's something that we can do ongoing to help improve the skin quality. When you're dealing with a structure that's this thin, you really have to be strategic. Too many people go to too many different places, getting too many different heating devices, and ultimately their skin becomes thinner and crepier. So I think that you're on the right track with this, doctor. I think you have to learn the balance of this risk of hypopigmentation. And as a general rule of thumb in this world of either ablation by chemical or laser, there's a critical amount depth needed to get a certain level result. But the deeper you go, the higher the risk. And so it's always a balance. So continue talking to this doctor about this CO2 laser. You're probably on the right track. And hopefully what I've provided for you is of value. So I hope that was helpful. I wish you the best of luck. And thank you for your question.